here's just a general, just so you have some sense of the types of challenges that our senior residents face when they enter nursing homes. The amount of folks that are injured in nursing homes is really one of the more tragic stories of what's been going on in this country over the past, I would say, probably 40 years. The Medicaid laws went into effect during President Johnson's administration back in 1965. And prior to 1965, the use of nursing homes were not, it wasn't as widespread by any stretch. You know, as a society, most elderly folks continued to reside in the home, and that was a function of the fact that inside, I don't want to offend anybody, but more women were able to stay at home. And that simply isn't the case anymore. It's the rare instance where both spouses aren't out for a significant portion of the day working, and as a result of that, nursing home care has become more widespread. That it also has become the case as a function of Medicaid's adoption in 1965, whereby a fund was created so that folks would have some way to supplement putting a loved one in a nursing home if they felt they couldn't care for them. But since people have been residing in nursing homes, these are the types of issues that you're seeing. And the most prevalent issue in any home is falls. We're going to talk about 6 or 7 categories of injuries, but the thing that you see most frequently are falls. And that statistic that as many as 3 out of 4 nursing home residents fall each year, which is twice the rate of adults who fall when they're on their own or just at home with somebody probably of the same age, would seem counterintuitive. You would think that if somebody is in a facility, they'd be getting the kind of care and the kind of oversight that would effectively prevent fall-type injuries. And that's not the case. And the reason why we need to be vigilant about that is that, and I'll talk in a few minutes about if you're come to that point where one of your loved ones, or maybe even you yourself, is thinking, you know what, I need a more controlled environment. I think I'm ready to transition into a facility. You really need to kind of look around, mindful of the types of problems that confront people in these homes, and say, what are they doing to prevent people from falling? What types of protocols do they have in place? In other words, if somebody isn't able to walk, and I think the statistics demonstrate that there's people falling who really shouldn't be trying to get on their feet without the assistance of either 1 or 2 staff people. And I'm jumping around here a little bit, but the principal reason for falls is because staffing does not permit, or facilities do not have adequate staff. They're good people by and large that work in these facilities, but if you're trying to man a nurse's station and trying to ensure that the people are eating their lunch who need some help eating their lunch, and then a call bell rings for somebody who's wheelchair bound, but one of the most fundamental, I think, concepts with our dignity is to get to the bathroom still on our own, so that you don't have to have a catheter in, or you don't have to use a bedpan. So for people to be able to at least get to the point to get into the bathroom and go to the bathroom, that's where you see, in my practice, I get contacted by people who've had a family member who's fallen in the facility. We see those cases all the time, and I will tell you, a substantial portion of those cases occur when the resident is trying to get to the bathroom. So when you're looking at a place for a parent or a loved one, that's what you want to talk to the staff about. What is the protocol here? My mom is wheelchair bound now. How do you folks handle getting into the bathroom? Do you care plan for it? At the time you enter a facility, both the federal government regulations that I'll talk about in a little bit and that are set forth in the materials, and the regulations of the Commonwealth of Pennsylvania. Regulations both that apply to nursing homes as administered by the Department of Health, and regulations that apply to personal care homes as administered by the Department of Public Welfare. Both have specific provisions about care planning, so that there is a framework that exists for when your loved one goes into a facility, and then if they do need assistance toileting, will that be given to them? So that's why, you know, we talk about falls being a major problem. And these are national statistics now. These aren't Commonwealth of Pennsylvania statistics. But close to 2,000 people living in nursing homes die each year from falls. Now that's not necessarily instantaneous death, but if you wind up with a fractured hip that immobilizes you, and as a result of that, you have to be catheterized, and then you wind up, you know, with a urinary tract infection. This can be a snowballing effect that can happen pretty rapidly. So the results of these falls can be, you know, catastrophic, and they also obviously have a profound effect on people's mental state. You know, once they have a fall, they become immobilized, and they become even more reliant on the caregivers in the facility. And then if you have a shortage in staffing and folks are not able to get up, that creates even greater problems.